All right, this is almost the end of week 2 at Happy Tales, the beginning of another era. Anyway, our buddy here is brought in. As you can tell by looking at a distance, this guy's actually having a little bit of difficulty breathing, developing action of the body, and when his tail is free, you can actually see a little bit of bobbing there as well. His respiratory rate is probably 20% higher than it should be. We're actually going to trim some wings today and do some nails, but we're going to hold off on that for now, just because it might not be the safest thing in the world for this guy. Anyway, we just did a nasal cytology, since you can actually hear most of the noise coming from his nose. Up there, yeah, you, up there. And so it turns out that we're both bacterial. We have colonies of rods, and we also have tons of very, very small budding yeast. So we're going to start him on some antifungals and some antibiotics. The antifungals usually work pretty well. Most antifungals work pretty much the same way by inhibiting the cell wall synthesis. But when it comes to antibiotics, they're a lot more complicated because bacteria are just a pain in my butt. Mom's smiling, but she's not saying anything. That's okay. And as you can tell, his eyes are closed. He's a little bit on the I'm not feeling too well side. Anyway, so we're going to go ahead and get him started. This is what it looks like today. If all goes well, I'm sure the fungi will start to respond pretty much in a matter of 2 or 3 days. The bacteria, if we're not starting any improvement by Monday, let's go ahead and get him back and we'll do a culture and send it off.
Sounds great, Doctor. Thank you.
You're welcome. All right. Later, dude. So bye. Feed me, Seymour. Later.